Something that a lot of people don't realize is how detrimental nightmares can be. They're not like dreams that you can just ignore and hope that they'll go away. They really do need attention because nightmares are implicated in all forms of mental health issues as well as a lot of serious physical health issues. And this is new information. And a large European study that came out just this past summer showed that nightmares lower your life expectancy. And there's also a large body of research and growing that shows that nightmares dramatically increase the risk of suicide. They're an independent risk factor for suicide. So there are some very compelling reasons to pay attention to nightmares. I'm Dr. Leslie Ellis. I'm the author of A Clinician's Guide to Dream Therapy. For more than 10 years, I've been teaching therapists how to use embodied experiential dreamwork practices to transform their dream lives and recover from their nightmares. Think about how often this might come up in your practice, where you have a client who is suffering from nightmares. They might have post-traumatic stress, and they will come into your session saying, I just had another nightmare and it was really terrifying and really awful. You might work with their underlying trauma and you feel like you're going to help them a little bit, but you wish for something that would actually bring them real relief from these nightmares. I want to let you know that I'm hosting a 1-day online workshop with the Academy of Therapy Wisdom called Walking with Nightmares. This is an immersive experiential program designed for therapists to not just hear about why you might want to treat nightmares and how to, but to actually experience some of the steps yourself. And so by the end of this day, you will actually feel comfortable with applying this right away in your own practice. Rather than interpreting dreams, I'm teaching you how to work with the dreams directly. And this powerful practice has the result of permanently changing the way someone experiences their dreams. I'll give you one example from my doctoral study. And in my research, I worked with refugees who had severe PTSD and recurrent nightmares. And nightmares, in fact, were the single biggest problem that they reported. With this particular participant, she was a woman from Congo who had the terrifying experience of being held at gunpoint and basically being told that she had recriminating information that they wanted her to share. And in her actual experience, as well as her recurrent nightmare, she froze, which is a really common response to severe threat. But she couldn't find her voice and she couldn't speak. In the process of helping her with this nightmare, I trained therapists to guide a person safely through their dream. And this woman, in her reenactment of this dream, was able to find her voice and to speak up. And simply that, over years and years of having this dream, the dream would stop with her being unable to speak and being frozen. And in the reenactment, she was able to find her voice and to speak. And a couple of really wonderful things happened. The first thing is that the nightmare never came back. She simply stopped having this dream, which is a wonderful result. It doesn't happen every time. The other thing she said is that she also found her voice in waking life, in circumstances where she normally might have been silent or not stood up for herself. She actually was empowered by this process to be able to stand up and speak in everyday situations as well. So this is a dramatic example of a refugee with traumatic nightmares. But this particular method can be used with any kind of dreaming, any kind of nightmares. I worked with first responders who have recurring trauma nightmares about particular incidents that have stuck with them. I've also worked with early childhood sexual abuse survivors, people with complex trauma. Virtually any kind of trauma that gets caught in their dreams and repeats in their nightmares is a target for this practice. The dreams are the same and they feel like they're never going to change. And yet with this simple process, their dreams start to shift, sometimes dramatically, sometimes incrementally. But in all cases, I've never seen the dream come back in exactly the same way again. The process is empowering and enlightening because so many therapists and so many people who suffer from nightmares have no idea that there's actually a lot you can do about these dreams. You can treat them, they shift, and it isn't a very difficult process. It's actually quite a simple one. So even though the technique is quite simple to apply, it does take some skill and some nuance. And that's what we're going to be working with in the presentation I'm offering on nightmare treatment. In this 1 day seminar, you'll learn the nuances of how to safely re-enter a dream with the client, how to engage with the dream in a way that's manageable and that enables them to carry the dream story forward so that they achieve the kind of mastery that the woman from Congo did. And what you'll find is that the dreams change, the symptoms that they experience really are dramatically reduced. And they also start to sleep better and start to feel less afraid of going to sleep. So there's a lot of really good things that happen from this very simple intervention that I'm going to teach you about. So there are a number of things you're going to learn in this 1 day seminar on nightmare treatment. And the first thing is to identify which nightmares are important to pay attention to. There's a number of identifying features that make nightmares more of a therapeutic issue. So you're going to learn what nightmares are within the realm of normal dreaming and which ones have a trauma-related aspect that makes them very important to treat. Then you're going to learn how to guide clients through a safe somatic dream reentry process that will enable them to reenter their dream and change it. You'll also start to see that this practice can actually transform the nightmares. You'll start to be able to understand how to track subsequent dreams to see how well the process is working. And you'll learn to use dreams as a diagnosis. So dreams have different qualities that will be able to tell you how far along their healing process they are in their trauma recovery. You'll be able to see if the interventions that you're using are working. And so you'll be able to tell simply by their dreams and tracking their dream progressions how far along they are in their healing process and how helpful the intervention is and how to adjust what you're doing so that it's the most effective intervention that it can be. Other thing to know is that you can integrate this practice into any therapy modality, whether you use EMDR, IFS, or other somatic interventions. This particular method is agnostic. It can really be applied to any methodology and it works seamlessly. It's really specific to dreaming and to nightmare treatment. And most therapists really don't seem to have this in their toolkit. So I want to give you a simple method that actually integrates with how you already practice. It will feel seamless to your clients. Most therapists tell me that they're actually not that comfortable working with dreams. And it's because dreamwork training is not part of the mainstream psychotherapy training anymore. So a lot of people tell me that when a client brings a dream, there's a feeling of panic of what am I going to do? So picture this after taking this training, when a client brings a dream, rather than have this feeling of panic, of having sort of uncertainty about how to proceed, that you feel confident. You actually think, oh, good, there's an opportunity here. There's a new avenue for healing. And you listen to their dream and you can guide them through it safely with the techniques you're going to learn. And you give them a new resolution to their dream and they come back to you telling you that they've slept better or they've slept through the night for the first time in a long time, which is something I hear often. And you have the satisfaction of knowing that you've really helped them with something deeply disturbing that actually could be dangerous to both their physical and mental health. You have the satisfaction of knowing that you've truly helped them. So what will you receive when you take this training? You'll get lifetime access to the recording. There's also going to be a live Q&A, so you can ask me questions about this and ways that you can apply it directly to your own clinical questions in your own practice. There's also going to be an experiential live demonstrations and experiential practices that you can do right in the session. So you have a chance to try it out with each other and ask me questions about it as we go. So you'll walk away with a well-researched, compassionate method that you can apply, and you'll have tried it on a little bit. So you'll have some understanding of how to use it in your sessions, the language to use, and the kinds of things that you're comfortable doing with your own clients. So you'll leave ready to try this. You might be thinking, well, I already work with dreams, so I don't really need this extra information. And it's true, especially if you have a background in Jungian psychotherapy or other psychodynamic approaches, you may already know how to work with dreams. And that's actually a good thing. It will really help you apply this to have experience with dreams. And this is just a very specific protocol that you can add on to what you're already doing that is well researched and really specific to trauma related nightmares. You can be assured that what you're doing is an evidence based practice that's actually been shown to reduce nightmare frequency and distress and post traumatic stress symptoms. So you're going to be adding something that's really tried and tested and effective. You may also be thinking, I'm already getting really good results with the trauma work I'm doing. So do I want to mess with that? Do I want to add something that might be disruptive or scary? I would say in that case, it's good to keep doing what you're doing, but also understand that nightmare treatment is something over and above trauma work that can really accelerate the healing process. And if you have clients who are having severe and frequent nightmares and the trauma work you're already doing isn't really touching those, then you need to address the nightmares directly. And what's wonderful about the research is showing is that when you address the nightmares directly, it also helps with the trauma recovery process. It can speed the trauma recovery process because your clients are going to stop having such terrifying dreams. They're going to sleep better. And a lot of other really positive things can come out of all of that. So I want to invite you to join me for this one-day course called Walking with Nightmares, which has the potential to change the way you work with trauma dreams forever. You can feel confident now when people bring you nightmares that you have a tried and tested evidence-based way to help them recover from their nightmares, help with their trauma healing, and find and reclaim peaceful nights. They often will be afraid to go to sleep if they have recurrent nightmares, and this will help them sleep more peacefully. And it has this cascading effect of many other ways to help their trauma. We're only offering this live workshop once. So if you'd like to be in on the actual experiential aspects of it and talk to me directly, this is your chance. I hope that you take me up on this and you can help your clients reclaim their peaceful nights. And I'll see you inside.